Dyspnea. It's abnormal, uncomfortable awareness of the act of breathing equals shortness of breath. Feeling of being hungry for air, gasping for air, or working harder to breathe. About causes: 3 normal causes: exercise, anxiety or smoking, pregnancy and obesity, respiratory conditions discussed later, cardiovascular conditions discussed later, 2 medications, statins, cholesterol-lowering drugs, beta blockers, treatment of high blood pressure, systemic conditions, 1. Angioedema, 2. Epiglottitis, 3. Liver cirrhosis, 4. Acute renal failure, 5. Sepsis, 6. Metabolic acidosis, 7. Anaphylaxis, 8. Thyrotoxicosis. Other conditions: 1. Injury like a broken rib, 2. Extreme temperatures, 3. Lack of exercise, muscle deconditioning, 4. Sleep apnea. Respiratory conditions: 1. Allergies and asthma, 2. Obstruction, chronic obstructive pulmonary disease, 3. Inflammation, respiratory illness, bronchitis, pneumonia and pleurisy, 4. Fluid, pulmonary edema and pleural effusion, 5. Blood, pulmonary hypertension and pulmonary embolism, 6. Air, pneumothorax, 7. Foreign body, choking, 8. Other diseases: TB, sarcoidosis, fibrosis and lung cancer. Cardiovascular conditions: 1. Heart failure, e.g., valve diseases, congenital heart diseases, 2. Conditions that affect your heart muscle, cardiomyopathy, 3. Abnormal heart rhythm, arrhythmia, 4. Inflammation in or around your heart, endocarditis, pericarditis or myocarditis, 5. Blood, anemia. Follow dyspnea. We have 3 types of dyspnea. The first one is exertional, means shortness of breath. Its causes: 1. Lack of fitness and obesity, body mass index above 30. 2. Respiratory conditions. 3. Cardiovascular conditions. 4. Systemic conditions. The second type is paroxysmal nocturnal dyspnea, PND. It's dyspnea, cough plus wheeze developed 1 to 2 hours after sleep. Remember, sighing dyspnea is when you sigh a lot after taking deep breaths in trying to relieve the feeling of dyspnea. PND is highly specific for cardiac cases. Diagnostic for left-sided heart failure, but we have to exclude bronchial asthma. We have 4 causes for paroxysmal nocturnal dyspnea. 1. Cardiac asthma due to left ventricular failure occurs 1 to 2 hours after sleep. You have frothy sputum and spontaneously relieved. 2. Bronchial asthma occurs in early morning. You have thick sputum and relieved by bronchodilators. 3. Other respiratory conditions: COPD, pulmonary edema, sleep apnea, pulmonary artery embolism and restrictive lung diseases. 4. Other medical conditions: 1. Stomach acid reflux, GERD. 2. Kidney failure. 3. Anxiety or panic attacks. The third one is postural. It's dyspnea on certain positions. We have 3 types. Orthopnea, dyspnea on lying flat relieved with erect position. You'll feel short of breath when you lie down. Sitting propped up on 1 or more pillows can improve your breathing. In most cases, orthopnea is a sign of heart failure. How many pillows you need to use can tell your doctor about the severity of orthopnea. For example, 3-pillow orthopnea means orthopnea is very severe. Platopnea, dyspnea on erect position. Trepopnea, dyspnea on lying on one side. Follow dyspnea. We have 2 categories: acute and chronic. Acute dyspnea. Come on quick, short attacks hours to days. Completely normal between episodes. We have 4 causes. 1. Exercise, anxiety, panic attacks and common cold or flu. 2. A heart attack, that's a serious condition, and blood clot. 3. Allergies, asthma and lung infections like pneumonia. 4. Aspiration of food, inhalation of any object, sudden airway narrowing, anaphylaxis. In acute dyspnea, ask about duration of onset, background symptoms of exertional dyspnea and usual exercise tolerance associated symptoms, chest pain, syncope, palpitation or respiratory symptoms, such as cough, sputum, wheeze or hemoptysis. Chronic dyspnea. A long time, several weeks or longer, keeps coming back. Progresses over time. Example: feel short of breath with moderate activities like climbing stairs. We have 4 causes. 1. Heart attack, CHF and arrhythmia. 2. COPD, asthma, pulmonary hypertension, lung cancer. 3. Ongoing health conditions, cancer, kidney failure, or anemia. 4. Lack of exercise and obesity. In patients with chronic symptoms, ask about relationship between symptoms and exertion, degree of limitation caused by symptoms and their impact on everyday activities, effect of posture on symptoms and or episodes of nocturnal breathlessness associated symptoms, ankle swelling, cough, wheeze or sputum. Heart failure is the commonest cardiovascular cause of both acute and chronic dyspnea. The following table shows some mechanisms and causes of heart failure. We have 4 main mechanisms: defect in systole, defect in diastole, increased cardiac demand, and valvular congenital lesions of the heart. We will discuss causes of each one. 1. Reduced ventricular contractility, improper systole or systolic dysfunction. Usually due to myocardial infarction, defect in blood supply. Defect in the cardiac muscle like dilated cardiomyopathy, e.g. genetic, idiopathic, alcohol excess, cytotoxic drugs. And peripartum cardiomyopathy, myocarditis, defect in myocardium. 2. Impaired ventricular filling, incomplete diastole or diastolic dysfunction, usually due to left ventricular hypertrophy, constrictive pericarditis, hypertropic or restrictive cardiomyopathy. 3. Increased metabolic and cardiac demand that is rare and occurs in certain cases like thyrotoxicosis, increased general metabolic demand, or defect in heart, arteriovenous fistula, and also in Paget's disease. 4. Valvular or congenital lesions due to mitral and or aortic valve disease, tricuspid and or pulmonary valve disease, rare, and other congenital lesions, ventricular septal defect, patent ductus arteriosus. Other cardiovascular causes of acute breathlessness include pulmonary embolism and arrhythmia. Patients with acute heart failure and pulmonary edema, accumulation of fluid in the alveoli, usually prefer to be upright. Patients with massive pulmonary embolism are often more comfortable lying flat and may faint, syncope, if made to it upright. Exertional dyspnea or orthopnea is the symptomatic hallmark of chronic heart failure. The New York Heart Association grading system is used to assess the degree of symptomatic limitation caused by the exertional breathlessness of heart failure. This table shows classification of the heart failure symptom severity. We have 4 classes. Class 1: no limitations. Ordinary physical activity does not cause fatigue, dyspnea or palpitation. Asymptomatic left ventricular dysfunction. Class 2: slight limitation of physical activity. Such patients are comfortable at rest. Ordinary physical activity results in fatigue, palpitation, dyspnea or angina pectoris. Symptomatically, mild, heart failure. Class 3: marked limitation of physical activity. Less than ordinary physical activity will lead to symptoms, symptomatically, moderate, heart failure. Class 4: symptoms of congestive heart failure are present, even at rest. With any physical activity, increased discomfort is experienced, symptomatically, severe, heart failure. Dyspnea caused by myocardial ischemia is known as angina equivalent. It may occur instead of, or with, chest discomfort, especially in patients who are elderly or who have diabetes. It has identical precipitants to angina and may be relieved by glycerol nitrite. Orthopnea, dyspnea on lying flat, may occur in patients with heart failure, where lieutenant signifies advanced disease or incipient decompensation. Lying flat increases venous return and in patients with left ventricular impairment may precipitate pulmonary edema. The severity can be graded by the number of pillows used at night. 3-pillow orthopnea, for example, means you have severe heart failure. Paroxysmal nocturnal dyspnea resulting in sudden breathlessness that wakes the patient from sleep. Patients may choke or gasp for air, sit on the edge of the bed and open windows in an attempt to relieve the distress. It may be confused with asthma, which can also cause nighttime dyspnea, chest tightness, cough and wheeze, but patient with heart failure may also produce frothy white or blood-stained sputum.